I'm Dr. Owsley, and I work at Owsley Plastic Surgery, and hopefully soon to be August 1st, I'm opening Reflections Aesthetic Spa. Been here for almost 30 years and still going strong and still enjoying everything I do. My job, the way I look at it, is actually to educate the patient on the particular procedure that they're looking for. Under no circumstances do I make any decisions for the patient. I explain to them what can be done, how it can be done, what the options are, what's the post-op course, the healing time, potential risks, and then they have to make a decision based on the knowledge that I give them. I never want to convince somebody to do cosmetic surgery because it's not my choice, it's theirs. The first thing they have to do is decide if they're going to have cosmetic surgery. Then they have to initiate a phone call to a plastic surgeon's office. So they'll call the front desk and say, "This is what I'd like to do. Can I see the physician?" Sure. So they schedule an appointment. Patient comes in, fills out the typical medical history and stuff, and my assistant will then meet with her and ask her exactly what she wants. And then I do a physical examination, and then we come back into my office and we have a lengthy discussion because this stuff is complicated. So it's pretty detailed discussion of the procedure, and like I said, what's going to happen in the operating room, what's going to happen post-op, the required follow-up, the healing times. So we go through a thorough discussion. After that, I tell them, you have to make a decision whether you really want to do this or not. Once they get that base of knowledge, they have to make a decision on whether they want to do it. If they want to do it, then they'll have a scheduled time for surgery or a scheduled time with Alexis for laser or Botox or whatever. For me, for surgical patients, basically there would be a pre-op, and that's where consents are signed, photographs are taken, prescriptions are filled, and they kind of get all packaged up for that day of surgery at Northwest Specialty. So it's pretty fluent in the way it runs. And then of course post-op, I'll typically see my patients on post-op day 1 week, 6 weeks, and the last visit is around 6 months. Like I said, I do not ever want somebody to come here that I've tried to convince to come here. It's a real personal decision. This is a huge deal because basically they're asking to be operated on when they don't have to. It is such a personal thing that only they can make any decisions whatsoever. And like I said, my job is only to educate them so that they can make wise decisions for them.